Hi everyone, this is Daniel, and I assume that if you're looking at this video, it's either because you've been told that you've got a hernia and you need to get it operated, or you already had the operation and you're curious about what the recovery is like. So, with no further ado, I will discuss a little bit about hernias. I'll give you some tips as to things that I suggest you do before the operation, things that you may want to do after the operation, and you'll be able to then see my progress from day 3 pretty much onwards throughout till day 17. I skip 1 or 2 days. I go into great depth, so you just forward and so you can see if you need to. And yeah, so hopefully this helps. Talk to you guys later, and good luck. Bye.
I just want to explain a little bit about hernias and the different procedures. Obviously, there's different types of hernias, so I'm only going to speak about inguinal hernias, which are the hernias right around the groin area, right where you would more or less think there's lymph nodes, maybe a bit lower than that, a couple of centimeters above your groin area, and they're either on the left side, the right side, or in my case, a bilateral, meaning it's on both sides. Um, and hernias are very, very common, especially amongst men. The reason for this is that there's basically what basically happens in a hernia is that your abdomen, your intestines, and so on can push up against the walls, your muscle walls, and so on. And over time, it could be a number of reasons. Pushing too hard on the toilet, typically things like lifting weights is very common. That's why people wear weight belts. But there's many other things. Sport injuries. It can be also based on genetics. So there's many reasons why hernias occur. It's not something to be ashamed of. In the US alone, it's one of the most common operations that takes place. I think 750,000 operations take place every year. So it's very common. It's not a complicated surgery. So, in that sense, even someone who doesn't have, magic hands, or a surgeon with thousands and thousands of hours of experience, just a learning apprentice surgeon is actually capable of doing it. Although I would always suggest that you do your research, take a look at the surgeon. The more experience he has, the better. Now, where experience really makes a difference is in the procedure itself. So there are different methods of handling hernias, and unfortunately, hernias, they need to be taken care of by surgery mainly. Now, there are some people who say you can get around it by doing certain muscular exercises, like lifting up your legs, laying on your back and lifting your legs up in up to 60-degree angle. But to be honest, I don't think it really can make such a difference. Maybe it can help reduce it, from ever occurring. But once it has occurred, it's going to be really difficult to get around it. The main risk with a hernia is that the intestine comes through the muscle wall and then gets strangulated by the muscle itself, and then the feces and so on cannot go through, and your system will start getting poisoned. You'll start to get nauseous and sick, and you need to then take care of it like immediately, or you can die. Now, the chances of that happening are low. Nevertheless, that's the big risk, and obviously, having this this area of weakness where the intestines can push through the muscular walls is something that can cause pain. It can cause a rip, and therefore it needs to be treated. Now, hernias are far more common amongst men. And the main reason for this is that we have a spermial tube. I don't know exactly what the name is, but it's a tube that connects from the scrotum to the penis, where the sperm travels through, and this has to go through the muscle tissue. So there's actually a hole there allowing that tube to go through, and when you're lifting a lot of weights, that hole gets stretched and can sometimes rip. and that's where hernia starts. That's why men have a much higher risk of it, but women get it too. So it's not just that. Now, when it comes to surgery, there are several methods of taking care of it, and you need to. Might be a difficult decision point. For me, it was partly a difficult decision as to which way to go. There's like the open surgery method, which is basically an incision about 6 to 8 centimeters long that they make through 7 layers of different types of tissues and muscle, and then they knit the areas that are damaged, and they close it up. There's the open surgery, but with a mesh, where they do the same thing, but they, in addition to knitting, they add a mesh that is weaved into the muscle tissue, and it creates a layer of support. And this is I would say, the most recommended way, because the results have always been the highest. Open surgery gives you a 0.1% chance of recurrence. So it's the most standard way of doing it. It's takes a bit longer in terms of healing, because you got a direct cut. An 8 centimeter cut is quite a cut, especially through 7 layers of tissue. But it has the highest likelihood of success, and it's the easiest for the doctor to do because he has direct access. He can see what he's doing. So when it comes to having inexperienced doctors, open surgery and with a netting is probably the safest bet to go by. Now, I went to a specialist, and he was a laparoscopic expert, and this guy was doing like kidney and liver transplants and things like that, which is like just crazy stuff, laparoscopically. And he told me he wanted to do open surgery. So I was like, why do you want to do open surgery if you're a specialist in this other area? And and I'll go into more detail as to what laparoscopic surgery is, but he basically told me that because he sees that I'm kind of like an active guy, I'm fit, even though I'm 40, I'm still very active, and I do a lot of fitness. So he said, look, if you're an old guy who's not going to be moving around too much, then the best bet is that, we just do laparoscopic. You'll heal faster. There's less, damage to your body, and be done with it, because the chances of you ripping it again are going to be minimal, because you're old and you're just not active. Maybe it's not just old, but the fact that you're active is the main component there. However, he said, since you're an active guy, I want to give you the highest chance of full recovery, and to have that full strength, so you can do all the sports that you used to do in the past without it coming back. So he said, in your case, he suggests to do open surgery with the netting, and since I had it bilateral, both sides, so it was like, oh gosh, I'm gonna have 2 times like 6 to 8 centimeter slices in my abdominal. That's gonna be a real tough thing to take. I asked him about the pain. So let me explain, just before I go into that, what actually laparoscopic surgery is. Basically, there's 2, actually even 3 methods of it. So this is the alternative to open surgery. Laparoscopic is basically they have a tube that they push in, and there's 3 methods. The first method is they have a tube that goes through your belly button, and from there they push that tube in, and then they operate on the area, basically all the way down through they push the tube all the way down to the area, and then they operate. It's got a camera, it's got little tools on it and so on, and they're able to do the surgery and put in the netting and so on. Now, in order to do this, they need to also put a balloon into your abdominal muscles and inflate it to make space for that tube to go through. So in terms of pain, I think you know, especially if you've got ripped abs and so on, it's going to be a real painful thing, and it's going to hurt just as much. So don't think that just by doing laparoscopic, just because it's less damage to your body, that it's going to hurt less. It's going to hurt just as much. I'm pretty sure about it. So that's one thing to know. So that's one way of doing it. It's one tube. It's like I think it's like a 2 centimeter wide tube. So it's quite a pipe that goes in. Then there's another one where they actually go in from the sides with 2 tubes and one from in the center. The center tube is a 1 centimeter tube, and it's like a light. And then the sides are tools. So it's 3 incisions, smaller incisions, and I don't know for sure. You'd have to check on this whether they need to put in a balloon. I don't think so, because it's much closer to the wound where they put in the tubes. They don't go through your belly button. So that's the other way. And then there's a third way, which is using this like special robot. Hold on. Sorry about that. So yeah, where was I? Okay, so the third way is using some sort of special robot that can you know, if the doctor shakes with his hand, that the robot will correct that. And it's really fancy stuff that I think is maybe an overkill. I think that's something that you might want to use if you're going to get like freaking kidney transplant or something like that, and which I hope nobody ever has to go through. So those are pretty much the 3 ways. Laparoscopic surgery is typically at least twice as expensive. My bilateral open surgery with netting from a top surgeon here in Singapore at Glen Eagles Hospital, which is a private hospital and is considered to be one of the better hospitals here, one of the best, if not. It cost around, it was 25,400 Singapore dollars, and that just counted for 1 night in the hospital. So you can just see how the numbers add up, and it's quick. So make sure you got your insurance before you do something like this. If you're starting to feel stuff, I suggest you better get insurance, and then later on claim the problem. So that's it. Yeah, so that you understand how that goes, and so everybody is clear on what exactly a hernia is and what the different procedures are. So if you're an inactive person, if you don't, you know, care too much, and you just want to have the least damage to your body, then get laparoscopic. If you really want to have the highest chance of recovery, then go for open surgery with mesh, most probably. Clinical tests have proven over time that the mesh actually results in a better result than without a mesh. So that's something that needs to be understood. Another thing that needs to be understood is that there's a 1% chance of recurrence with laparoscopic, as opposed to 0.1% with open. And then that pain may be the same depending on which type of laparoscopic surgery you do as with open. And let's see, anything else I forgot? I think that's about it. Yeah, so keep all those things in mind when you go make your decision as to which type of surgery you want, and hopefully you choose the right thing. So take care. Oh yeah, one thing, very important. For laparoscopic surgeries, it's very important that the surgeon has skill, because you've got to understand the surgeon has to work on something kind of like remotely. He's not seeing it directly. He's not able to really knit it in properly the way he would be able to do it on an open. So the doctor needs to be skilled when it comes to laparoscopy. If it's open surgery, the doctor does not have to have such a high level of skill, so he won't mess it up as easily. So that's something that is important to keep in mind. All right, talk to you later. Take care. Bye-bye. Yeah, something I wanted to mention about hernia operations and so on. that are the main risk factors of the operation. Number one, there is the possibility for some bleeding. Can happen. I don't think it's a major concern, but it can happen. Then there is the possibility of that, depending on where the hernia is, that the doctor has to cut some nerves, and the worst case scenario means that you may not feel part of the inside of your thigh and the side of your scrotum. So yeah, if you're really unfortunate, they may have to do that. And then the last risk is damage to the spermicidal tube that goes between the penis and the scrotum. So for us guys, that is, of course. And that there's damage to that done during the operation. So I mean, those are the main things to worry about in the hands of an inexperienced doctor. In the hands of an experienced doctor, shouldn't be an issue except for the nerve. He may not have a choice. So yeah. All right, keep you posted. Bye. Forgot to mention the recovery time. So recovery time, according to the doctor, is more or less, he said, it'll take 1 week for sure, where it's going to be quite painful, swollen and so on, followed by a second week where you can already start working, although in my case doctor is giving me 2 weeks off work, and I suggest you take it, make sure they heal better, because you got to take care of yourself, especially if you're getting a little bit older. I'm 40, so yeah, you got to make sure you're careful. Be smart. There's no need to rush these things. 2 weeks is short, goes by faster than you think, and you won't have any complications. No matter what, he said after 2 weeks he would start me on some exercise program, such as fast walking, swimming, things like that. I think I can probably do it sooner than that, so I'm going to try to exceed that expectation, but we'll see. It really depends on how I feel. And then it can take anywhere from, I would say, I think I read it was anywhere between 6 to 12 weeks for absolute full recovery, and 12 weeks is probably somebody who's really out of shape, really old, gosh knows what, doesn't do anything all day, eats junk food. So for the average person, it's probably more around 6 weeks for full recovery. And from what I've been told is you can already start doing whatever you think you can do, without it causing, as long as you're still comfortable with it, it should be okay. If you feel discomfort, then maybe take it a notch down. And so, I think full recovery is like 100%, and I expect to be jogging already within like 3 weeks time from now. So yeah, let's see. I'll keep you posted. And for those of you who are doubting, your health in any way, I'm 40 years old. For the last 2 months, I haven't done a single bit of exercise simply because it was hurting too much, the hernia. And I went on holidays, and it just timing-wise, things didn't work out. I was kind of postponing the operation because I was fearing it. So yeah, I'm 40 years old. I didn't do any exercise in the last 2 months. I mean, besides swimming and things like that. And I'm vegan, so absolutely no meat, no nothing that comes from animals. So everything's possible. I'm in day 5. I'm feeling much better. So things progressing according to plan, and I feel that if I can do it at 40, being vegan, without really being in the best shape at the time, then I'm sure that most of you can manage even better than me. All right. Another quick tip that I really suggest you do if you're going to go have one of these operations is that you eat very water based fruits and foods and things like that before the operation and during the operation. Nothing heavy, nothing that's going to clog up your intestines and so on, because after the operation you're going to want to go to the toilet, and the medication makes constipation very, very likely. And if you have constipation with this type of operation, it's going to hurt a lot, to the point that you may need to go and get laxatives or enema or things like that, and it just makes things more complicated. So do yourself a favor, make sure you take light foods, very water-based foods. Me being vegan, it's a lot of fruits and veggies, so I didn't have too many problems. But even I did struggle for 2 days without having to be able to go. So yeah, just to let you know. All right, talk to you later. So hi everyone, this is Daniel, and yeah, I just had a bilateral hernia surgery, Inguinal, whatever it's called, surgery on Thursday. I was really nervous about it. I was shaking, and before going into the operation theater, as they call it, which was ice cold. And yeah, after waking up, must say I didn't feel too bad in the beginning. I could feel a lot of pressure in the area. That was about it, really. And then this was followed by, later on, in the evening, I had to, I felt very nauseous right around food time from the medication they were giving me. They were trying to give me all these painkillers and other stuff, and I wasn't really feeling too much pain at that time, so it was unnecessary and it made me nauseous. And I think that's got to do with the fact that I just hate taking medicine, period, and the fact that they were forcing me to take medicine and was not doing me any good. My body's just not used to it, so I'm more sensitive and I react to it faster, I guess. So with that, I ended up feeling nauseous. Then the next day in the morning, still I managed to sleep pretty well, actually, I must say. And then it must be still from the general anesthesia. I did the direct cuts, so nothing through some sort of tube surgery, and they tend to be a bit more painful, but for me it was okay. And then the next day, again, they gave me the meds and they made me really feel like shit, and to the point that I had to vomit. And of course, when you got that type of cuts down there and you need to you need to throw up, it's just about the most painful experience. You just see stars, I tell you. And I think the nausea bothered me the most of everything. But I was so relieved that the whole thing was over and done with. So, all that tension was gone. And because I just hate being sick, I guess everybody does. In any case, then the next day in the evening, around 11, 12ish, around midday, I actually walked home. I had to take a taxi and everything. And just the fact that you can do that was amazing. I thought it'd be much more painful, because I remember my wife's operation when she had my daughter, and that was a cesarean, and it was very painful for her for a week. I mean, she couldn't, barely walk. Any case, got home and just pain in the ass to lay on your back the whole time, and doctor said I shouldn't sit because it can cause more swelling to occur. So I'm trying to get that from stopping as much as possible, because swelling leads to pain. And yeah, and the meds are now a bit more, they're less strong, more doable. They were giving me like 12 pills. Now I'm down to like 5, so it's a big difference. So I slept all right, I guess. I've gotten really hungry. Going to the toilet, peeing was really difficult in the beginning, but then I managed with time. so that was good. But then defecating is, doing poopies is just really tough, really tough. So I haven't really managed to successfully do much, but just a little. And so that's, I guess, to be expected a bit because of all the medication and everything. But I hope it gets easier because, yeah, I can feel the pressure. Anyways, so that's it. This is day 3, and yeah, I can walk around. Sometimes really sharp pain, like a needle type of pain when you make certain moves. Otherwise, it's just a dull pressure, and it goes up the sides. I thought it would be more in the scrotum area, but it's actually not. It's more up towards the sides, like towards your kidneys. That's where the pain leads. But yeah, it's not half as bad as some people think it is. So all the best. Keep you posted. Ciao. So this is day 4, Sunday. I had my operation on Thursday at 8 in the morning sharp, and I was out at awake around 12 o'clock. So this is now the 4th day, and my experience last night, yesterday was pretty good, actually. I must say I was feeling really, really good, and then went to sleep, and experience was not so good. Was having trouble sleeping, and then around 4 in the morning I started to feel odd. I had to go to the toilet many times. Started to feel anxiety, strange anxiety, panicky type of feelings, and that wasn't so nice. That lasted for quite some time, and I was without appetite. So in the morning I contacted the doctor, and I spoke to him, and I asked him about if I could reduce certain meds or to get rid of some of the medicines that he's giving me. At the moment, at that time, I was taking one medicine for protection of my stomach, like sort of an antacid of some kind, a painkiller, a anti-inflammatory, and antibiotics. And after speaking to him, I was able to get rid of the medicine for my stomach and the painkiller because it's not hurting so much, thank God. So, but I had to stay with the antibiotic and the anti-inflammatory. So then I had breakfast. It was tough to get anything in, but after I started eating, it got a little bit better, and so did my anxiety reduce. And then I took the meds. I took a shower. I changed the dressing on my wounds. Wounds look okay. The dressing is causing some sort of rash on the edges where it sticks to the skin. I've had this before, so I know it's something with the stickiness of that. But for the rest, now I'm sort of I took the antibiotics, and so I've been getting a little bit of dizzy, drowsy, sort of high feeling, which is strange because antibiotics, I don't know if they're supposed to do that at all. But in any case, it could also be just from lack of motion, laying in bed most of the time. I shaved and all that. That helped a lot. Made me feel better. The only thing I notice is a bit darker around the eyes than usual. And yeah, obviously that anxiety stuff, and it's not nice to experience, but the pain is less. It's easier to get in and out of bed, and the swelling is reducing, so that's good. So I'll keep you posted on further updates. See yas. Hi guys, it's day 5. I had my operation on Thursday last week at 8 o'clock in the morning, and now it's Monday morning, 8 o'clock, 8:30 in the morning. So basically, yesterday I got off of the pain meds because they were giving me some form of anxiety, and I didn't want them anymore. I didn't feel too much pain yesterday, so I didn't take them after speaking to the doctor. So then went pretty well actually most of the day. Just hate laying on my back all day, and sitting up hurts a bit, and standing hurts, so you can only do it for a couple of minutes at a time. Sitting in a sort of like leaned back posture is also not ideal for your back. After a while it starts to hurt. That's about the biggest struggle I have at the moment. Then today I noticed the pain is definitely increased, but that's simply because the pain medication has worn off, and I guess that's just normal to be expected. I do notice that the inflammation is down a bit more, and the sides going all the way up to my hip bone, to the very side of my hip bones, are sort of a yellow blue that you would get after a bruise. So that's sort of like the healing color that you get after it's been healing for a while. When you get a black eye or so, it starts getting yellow after a while. So that's good. What else? Sleeping is really difficult. You just have to keep rolling from one side to the other. In particular, what I've been suffering with is because of the lack of movement, I guess, and maybe the medications. I feel that my muscles want to cramp up the whole time in my calves, in particular my calf muscles, and I know how painful that is because I've had that in the past, and that is just something I really, really, really want to avoid. So it's keeping me up at night because the muscle keeps twitching like it wants to get into a cramp, but I tried to stretch it out. I tried everything possible, but still it just keeps doing that, and it keeps me worried. In any case, yeah, so you just have to turn back from one side to the other, to the other, to the other, because it's just uncomfortable no matter what position you're in. For the rest, I already walked around the condominium, around the swimming pool here. It's a big pool. It's like an Olympic pool. So I walked around that, and so I was happy I could do that. I sat a little bit on the computer just for about maybe 20 minutes until the pain got like a little bit too much. Now I laid back down. We'll see how it goes, but I think generally speaking it's getting better. It's just taking a little longer than I thought, but at the same time it is the whole experience hasn't been quite as bad as I had thought it would be from day one. The main problem I had really throughout the whole thing has been the medications and the having to just not move a lot. That's driving me nuts. So yeah, let's see how it progresses. Talk to you later. Bye. Hi everyone. I wanted to touch on a couple of things that I think are really important, and that is mainly number one. This type of operation is inguinal hernia. They put in like a mesh inside the wound, and it's like knit into the muscle tissue, and that the muscle tissue grows around. And if you lay all the time without moving, what happens is that the muscle will grow around that net, heal around it, but because it's not used to being flexed in any direction, because you're just not moving, later on, if you start to move, it's going to form a lot of tension in those areas because it's not used to that. Whereas if you do move from time to time, that flexibility will be there, and you may not feel this tension when you're fully healed. Now, I don't know for sure, but this is just a theory of mine, but it seems to make sense. And another thing is, it's important that you make some mini goals, set some mini goals that you do each day. Maybe in the beginning it's just as much as like getting out of bed and standing up, going to the bathroom and taking a piss. But later on, it could be like for me yesterday was going up the staircase and sitting in the hammock for a couple of minutes and just enjoying being outside instead of like inside of the bedroom. Then today was for sure walking around the entire condominium, and I'll show you what that looks like over there. So I walked around that, and it was okay. I did it very slow, just walk like an old man. Basically, that's what the doctor told me. He says just walk around as if you're an old man. As you can see, I'm on my feet right now. So it's just it hurts, of course, but you got to keep at it. You got to try. You got to keep yourself a little bit of motion to your limits. I mean, don't exaggerate. I have no pain medication at the moment at all. So I mean, that's actually a good thing. It's a challenge I gave myself to see if I could get away with just having no pain medicine, and it's a challenge that I don't regret. So start, and like I'm on day 5, so start to get yourself more and more active, and I think as you get more active, so will you feel more alive, so will your wounds start to heal the proper way, so that later on you don't have to go through more pain because it healed in such a way that it didn't leave any room for stretching or anything like that. So yeah, that's it. Just set yourself some mini goals. Don't exaggerate. Take it easy, but do start to get active. I mean, once I start to feel much better, I will definitely be doing some core strengthening and some stretching and stuff like that to try to get back into shape. And I mean, I'll probably in 2 weeks time or so start going on some fast walks, maybe even starting to jog, I hope. I mean, that's the goal I have. If I can reach it, great. If not, then not. But shoot high, aim high, and you always reach a higher target than if you were to just aim low. All right, talk to you guys later. Bye. Is day 6 since my surgery, including the day of my surgery, so like the 5th day in recovery, I guess. However, it's been a tough day. I slept really poorly last night, so I was just not feeling good in the morning. I was tense. Maybe because I was eating Pizza Hut food at night. And that's not the smartest thing when you're trying to recover. I definitely recommend you eat something more nutritious, and that treats your body in a better way than Pizza Hut food would. Then let me see. Yeah, basically it didn't feel good. It was very dizzy most of the day. I have a spot near the incisions that is really painful. It wasn't that painful before, but now it's really painful. Everything else actually doesn't hurt as much. I walked around the pool once. I went to visit an apartment nearby because I'm moving pretty soon, and I took a shower. I changed the dressings on the wound. One side looks like it was really well done by the doc. The other side looks okay. It's not the best, but I've seen much worse from other people. So what else can I say? Yeah, I'm just worried about that spot that's really hurting. I think I may have done something moving around that I shouldn't have. I apologize for always making the video when I'm laying down in bed, but that's when I got the time and when I'm bored and like, okay, I'm gonna make a video now. In any case, today was tough, tougher than yesterday for sure, and I hope that tomorrow will be then a good day again. So let's see, I'm changing beds so that it'll be more comfortable. Back to my original bed. Right now I'm sleeping in my daughter's room, and yeah, see how that goes. So keep it posted. Catch you laters. Bye. All right, day 7. The well awaited for day 7. I slept well last night.
I slept in my own room again. I got some backache from maybe sleeping too much on the mattress, so I ended up laying on my stomach a bit throughout the night, and this caused a bit of swelling up higher on the incisions, so closer to my kidneys, kind of in that area, which is strange, but you know, it changes every day. This sharp paining that I had yesterday in this one particular spot, it has, you know, gone down by about half the amount of pain. So that's good. I'm happy to see that. I've been challenging myself to walk around the condominium swimming pool area, and I did that by timing myself each time, and my time's definitely going down significantly. So that's good. Although I must say it's a weird sensation to walk around the pool. You'll feel pains and stuff like that that you didn't have before in your legs and your back and so on. So you know, it's good. It just shows that you need to do it every once in a while. And I got myself something else that arrived just shortly. I'm pretty excited about, and it's a motivation tool. Don't tell the doc. But yeah, I got myself these right here. These are Bowflex weight set, and they cost me a pretty penny. And the reason I ordered them was simply to motivate myself to actually go out and get fit again as soon as I'm back in shape. But I've actually already been using them a little bit, just at light weights though. You know, just you got to keep some sort of movement going, otherwise you drive yourself insane. So I've been doing that. Another thing that's been keeping me going, another one of my secrets here, is basically this djembe drum. So the djembe drum, you know, I've been able to sit down and play a little. I suck. I'm a total beginner, but it kept my mind off the pain, kept my mind off other things, made me sit down without noticing the pain. You know, the focus was like on getting a rhythm going and stuff like that, and making sure the neighbors don't kill me. So yeah, tomorrow I go to see the doctor the first time post-op. I really hope that he gets me off the meds completely, and that he takes these dressings off the wounds, because I want to be able to take showers every day. I want to be able to, you know, the dressings bother me, especially if I go up the stairs, because they're folding, and that folding sensation causes some discomfort. So yeah, different things, but overall feeling better, and you know, I see the light at the end of the tunnel, believe it or not. So yeah, let's take it from there. Talk to you later. Bye bye. 8. It's now officially been 1 full week since operation. I had operation 8 days ago on Thursday at 8 o'clock in the morning. Now it's about 12 in the afternoon on the next week, Thursday. And I visited the doctor today, and he looked at my incisions and the region there. He said everything looked perfect. He said, you know, swelling and so on. The healing process is going exactly as planned. I got rid of the dressing, which is good. I have to put some cream on the wounds, and I have to start to walk more and more every day, according to him, to increase that threshold and stretch that area. What else? Take my last pill of antibiotics this evening, but I have to continue taking some medicine that causes the swelling to go down, and the mucus from building up. And I asked him about whether it was normal, the scrotum to be a bit swollen. He said, yes, that's very normal. I asked him about the pain points, because I have these specific points that really, really hurt. And he said that's exactly where he stitched the area and attached it to the bone, I believe he mentioned. So that's why that's expected to be a painful spot. I asked him about swelling further up. He said that's normal. He what else? He also had a picture of like a 4 centimeter size slab of fat that they had taken out from the wound, from the area, from the around the spermicidal tube, and he had sent that to check to see if it was cancerous or not. He said this is very common with hernias, that grows around that area,
but that, you know, the results were fine, so no need to worry there. And so everything is on plan, on, you know, on schedule. So that's good. I'm happy to hear that. I can now take proper showers, you know, with soap and everything, and, you know, for the whole body, and just be careful of not wetting the certain regions. So yeah, now I have to do a bit more exercises, walk around the pool more. You know, he said swimming is great, but I shouldn't swim until the wounds, the actual cuts, the incisions are completely healed. Otherwise, there's a chance that they split open again. And yeah, so keep you posted. Maybe not on a daily basis anymore, but we'll see. All right. Talk to you guys later. Ciao. Bye.
Day 9, and I moved a lot more yesterday and today than I did any other day. I think as a consequence, it's now hurting more than it did yesterday. So we'll see. Still that one spot that's killing me. The rest is actually pretty good. Wounds are healing really well. So yeah, that's it. Ciao. All right, everyone, it's day 12 and it's early morning. Day 12, including the actual surgery day. Basically, this is the scenario at the moment. I'm medication. The only thing I'm taking is an anti-swelling, anti-inflammatory, and no other meds. So I have no more medication issues. Then, in terms of the actual swelling, overall the swelling has gone down substantially on both sides, which is great. There still exists swelling near the scrotum and above the incisions closer to the kidneys, especially when I stand. I notice those at the top, and the scrotum itself is still somewhat swollen, which causes its own discomforts, but it's nothing major. So I'm surprised, but yeah, there still is swelling, and I expect it still to take a few days for that to subside completely. Then one thing I haven't tested yet, which is ejaculation itself. This is something that would be like the last test to see that everything functions as it should. I haven't done so yet because I want the swelling to go down as much as possible before I engage in that activity. But since the spermicidal tubes were not damaged according to what the doctor said, it shouldn't be a problem. Then what else? I still have the pain, in terms of pain, overall, it doesn't hurt during normal activities. It's just still a bit of tightness, but on the right side, I still have that one spot that's just killing me. And it comes and goes. It pulses now at different times of the day. Even if I lay down, it pulses pain. So I know that somehow the healing hasn't occurred fully there on that spot. When it's pulsing, it's a pain maybe from 1 to 10, 4 to 5, maybe 4. When I sneeze, cough, that really hurts, and that's like on a 9 to 10 scale. It's like a sharp, burning, stinging sensation. So that bothers me because I was hoping it'd be more like on the left side where everything is totally fine. The wounds themselves, they've actually on the outside have almost healed completely. The left side is as if it's like just scar almost. There's no more crust and so on. On the right side, there still is some crust, but not all too much. So soon I will take on swimming exercises. Doctor warned me not to do it too early as it may open the wound again if you stay in the water for too long. So I'm just going to wait a little bit more, maybe one more day or two, and then I'll go swim. Yeah, so that's it. I mean, I'm moving around much more in the house. I'm taking care of household duties like washing the plates, setting the table, making the bed. I take showers. I walk up and down the stairs. I even skip a stair sometimes. And I sit almost all day, not just in this like laying position like I am now, but in general, like sitting on a chair, which was very uncomfortable in the beginning.
What still is uncomfortable is like leaning down forward, um, getting in like a hawker position. This is still not the exact, not really a comfortable. You can still feel the pressure of the swelling, but that'll go down. I mean, every day it's a bit better. So uh, in that sense, things are definitely progressing. Overall, the progression is positive, but I still have that one spot that's just, like the Achilles heel at the moment. Let's see how that progresses. I keep my spirits high. I'm doing some light weights just to keep muscle atrophy from going down. And yeah, once the main pains are gone, I'm gonna start strengthening the core. So I'll keep you guys posted. Bye. So day 14, including the actual operation date, and I gotta say things are really starting to improve drastically. Yesterday I was able to walk practically, I think I walked about a kilometer to the nearby market and back, and I was fine. I had to stand in line as well for 40 minutes, so I was just standing there at the post office. This is normal here in Singapore. In any case, I felt great. The other thing is I was able to test to see if the last thing was functioning, and I have to say, the whole ejaculation thing worked fine, no problem whatsoever, no pain, no nothing. And I mean, for me, having had bilateral, meaning both sides, I had double the chance of anything happening that could possibly be problematic, and no issues there, so I'm really happy about that. Today is another beautiful day, so I plan to do more and more motion. I might actually go swimming today for the first time, because I think the wounds have healed far enough that they won't rip open anymore if I was to move. But I'm definitely going to be returning to the office next week, and yeah, in the meantime just doing home office type of things. So that's it. I mean, really there's nothing else to say. Things are just improving really quickly, and I'm going to start doing some core exercises, building up muscles little by little. Now that the swelling has gone down considerably, I can do more things than before. So start to move. That's what I would recommend for anyone in having done this procedure. All right, catch you later. Bye. Hi everyone, it's day 17, and I wanted to give you a quick post on the progress. Things have gone definitely better over the last couple of days. The amount of recovery between the days seems a little less than it used to be. However, I'm far more active, and I'm also doing exercises, and exercises including things such as core exercises to strengthen the lower back, exercises such as swimming, breaststroke in the swimming pool, and even free stroke. And obviously with that you're agitating things a bit more, so therefore the recovery will probably seem less than it was before. One thing I learned, however, was 2 days ago I went out with somebody to have a couple of drinks, and we had about six or so beers. Felt great when I was drinking, but the next day I felt really bad. I got a really strong case of diarrhea from it, and this was obviously something I wasn't expecting. So I was totally out the next day, feeling pretty lousy. And so what I discovered was that once you've had surgery, if the doctor does give you antibiotics like this doctor gave me, then it destroys all of the flora in your intestinal tracts, which helps with digestion and protection of your intestines and so on. So what you need to do after you've gotten off of the antibiotics a day or two later is to start with probiotics, and take some probiotics to bring in that flora again, that bacteria into your that good bacteria back into your intestinal tracts, and you will hopefully not suffer the type of things I went through. Obviously the dehydration, the diarrhea and all that caused me to feel pretty bad, and it sort of put me 2 days back in terms of progress. So if you can, avoid at all costs drinking, get your probiotics, and then things will go a lot smoother than they did with me, but it's a lesson learned. And that's it. I mean, besides that, I think things have progressed. I still have pain No doubt about that. I still have to be careful with the things I do, especially if I cough or sneeze. That can be excruciatingly painful, feels almost like the first day. I mean, really, almost exactly the same pain as I did on the first day. So that still sort of worries me a bit, but I think it will go away. I think because of the swelling going down, different areas of the wound are now starting to get feeling again, and therefore I'm starting to sense the pain there in those areas. And you'll notice that you will have areas that are completely numb right after the operation, and then they'll start to get feeling with time. But I'm keeping my heads up. So in any case, it takes a little longer than I expected, a little longer than you probably will expect it to take, especially if you're older, like me, 40 years old, especially if you've had open surgery, and especially if it's bilateral, which is all three cases are for me. Don't expect to go playing tennis or golf after 2 days. That's just not going to happen. That's nonsense. Even if you have laparoscopic and so on, that's just not reality. Any case, I hope all these videos have helped, and I hope I've been able to answer some of your questions, take some of your worries away, that you see the actual progress day to day, how long it can take. We're still not there yet, but I think now things will just, over the period of time, next month or so, things will really settle down. And if you have any other questions, just post them here. I'll try to answer them as quickly as possible. I hope this has been helpful, and thanks a lot for looking at these relatively long videos. Anyways, talk to you later. Thank you. Bye-bye. Take care, and good luck with your surgery and your recovery. Ciao.